My name is Gary Malone. I'm the Chief Executive of Voluntary Action Angus. I've worked in Angus for about 20 years now as a community worker, and I'm now heavily involved in the voluntary sector. I've been involved in health and social care integration since it started, and before that the Change Fund. And there's a lot of things that I've seen over the last few years that have been really special to me and been a privilege to be involved in. Some of these include the development of Care About Angus, which is probably one of the biggest social enterprises in the area, which provides preventative care for elderly and vulnerable people in the community. That started because the council had to make decisions about streamlining its workforce, and that meant they were getting rid of the home help service and shelter, and later than that sheltered housing services. So we worked with people who were getting services and with the home helps and other people to make sure we could develop a sustainable social enterprise, which was augmented with local people and communities who were volunteering through their befriending, volunteer driving and other things. Why that's really important is because what we've developed is a localised based care approach which builds the propensity of care within areas and helps people to recognise the value of care and the efforts of volunteers, and where this comes together to build new social enterprises. When we started Care About Angus, it was a real big risk because we had very little money and really big demands. But through the dialogues with the staff, who were absolutely excellent, and the people receiving services, the greatest thing was the hope and the relationships which prevailed, and knowing that there was a great demand for the service and people who want to do it. I would describe it as being a real privilege to be involved in it, but my job is just to get it started up and to make sure it's a sustainable organisation and help it to move forward. Since the start of Care About Angus, that was November 2015, we had 28 staff, and now that's grown to around 100, and they're also looking to take on quite big volunteer driving and befriending movements within the county as well. The Minister for Health and Sport, Shona Robinson, come and launched it in April last year, and that was really a significant event in itself, and it gave a lot of confidence to people who worked really hard to make this happen. Why this is important is because I believe that a lot of the organisations who will provide the future of health and social care didn't exist, and they have to be built differently with relationships and cultures and beliefs within communities around building a Scotland that actively cares. This is important because as we all get older, we'll all be requiring health and social care services locally. We didn't want to be spending our lives in hospitals. We want to be in communities where people love us and where our families are around us. So it's up to us to invest in that future by the work we do today and creating organisations of the future. The important thing about the City Deal initiative is that it provides the opportunity for people to be involved in localised care, either through their volunteering or moving on from their volunteering to become learning into how to be a care worker within their local community. Local people want to care. Our recent survey that we've done suggested that 84% of people would actively care for an elderly or vulnerable person in their community, but they've never been given that opportunity. The City Deal stuff's about creating that opportunity, and it's also about making sure that localised learning is available to everybody who wants to help a neighbour or wants to help in a formal way through having a career of privilege in localised care. That's it.